Joan, you're now a public advisor for ARC Northwest Coast. So obviously you're using your lived experience. How's that journey been for you?
Amazing. It's been absolutely amazing. It's, as a public advisor now, I've gained knowledge and about dementia. I've mixed with other public advisors, listened to their stories. So you don't feel so alone, yeah. And being able to have a voice and share my experiences has been amazing. And to work with researchers and to take that knowledge out and share it with, within our community, within my community, because I've done that a lot. I've gone, and I've took the research out there and I've shared it with people, because, I think carers, I feel like that I've been educated, and that education has helped me so much. I've gained new skills, I've gained confidence, and I feel valued now and respected, because everyone in the ARC Northwest Coast, the researchers and everyone, has valued me. I feel valued. I never felt that before. It's like sometimes when you're with social workers or within social care, the NHS, it's like it's like your voice isn't being heard. It's like, I'm the carer. This is what I'm serving. This is what we need. These are my experiences. But within the ARC Northwest Coast, it's just been an amazing experience. I also became involved in dementia research projects with Clarissa and her team. And I've gained skills, I've been listened to, and I just feel that my opinions have been valued, and I feel like I'm helping other people by sharing my by sharing my lived experiences. I also got involved with the co-production of the Dementia Inequalities board game, and that's been amazing. That game, I've took that out and spoke to people and played it with people, and and pre and post diagnosis. It really does inform carers of their rights, of what is available, duty of cares. And it also, by the questions and answers, it highlights what you know and what you don't know. And it can lead you actually to make your own little social care assessment, and and to go to your doctor or to your healthcare providers and say, look, this is what should be happening, diagnosis, interventions, treatments. So that has been a really good experience. And I'm now trying to take that out into the community, and set up, support groups and that. So that's good. And I also feel at times I haven't been well, I have health conditions and that now. And I feel like that, I've been given the time, when I've contacted people and said, look, I'm not too well, then I've been shown compassion and empathy, and haven't felt under pressure in my role as a public advisor.
Joan, we'll just carry on a little bit before we run out of time. Can you tell us, obviously now you're a public advisor and you're doing a lot of research, but are there any particular questions do you think researchers should be asking to improve the lives of carers?
Yeah, I thought about this, yeah. And specifically, yes, there needs to be research projects and data gathered to understand the inequities and inequalities unpaid carers face. So specific questions like, has there been continuity of care? Is the person you care for receiving the right post-diagnostic support to meet their needs? How many hours per week as a carer are you working? Has it impacted on your emotional, mental and physical health and your own family health? I think that's an area that needs to be looked into, because, caring for someone for 30, 40, 50, 60, 24 hours a week really needs to be identified. So the local authorities, councils, the governments are aware of the value of carers, and and depending on how many hours you work and that, you know, your needs need to be assessed so that this doesn't impact on your health and well-being. Because as a carer, what we tend to do is care for others and not care for ourselves. Yeah, it just becomes an everyday thing, doesn't it? And we also, you know, and also I would say researchers need to look at, you know, what respite is available for carers, what help and support, financial support, even to have a break. You know, and ask the question, have you had any training, or what advice have you had to support you in your caring role? And that really needs to be looked at and explored.